Hello friends. So today let me demonstrate how to look for a normal right subclavian artery and how to rule out an aberrant right subclavian artery. So uh, if you try to find a normal right subclavian artery in each and every fetus, that would automatically rule out aberrant right subclavian artery. So this is what we are going to see today. So these three cases which I'm going to show are today's cases only, which I saw today itself, and those are of different gestational ages. One is 16 weeks fetus, then I'll show you at the 20 weeks fetus, and another at 28, 29 weeks fetus. Okay, so you can see the 16-week fetus. We can see the PRF values. This is a cardiac preset. This is the PRF values which we generally use in the to look at the fetal heart. The inflows and the outflows is usually 60 to 70 centimeter per second. Okay, so if you try to just see, look at the PRF, it is 60. This is the 4-chamber cardiac, 4-chamber apical 4-chamber view of a 16-week fetus. So as soon as we reach the 4-chamber view, okay, then we decrease the PRF. Look, I'm decreasing the PRF. Now the PRF is somewhere around 16, somewhere around 20. We have to make it somewhere around 20. Look, now this is somewhere around 20. So we can see the pulmonary veins draining into the left atrium. So this will rule out TAPVC as well. And this is the preset, that is a low velocity PRF, a low PRF, which is used to see the pulmonary veins. That is the PRF which we use for the aberrant right subclavian artery as well, to rule out aberrant right subclavian artery. Okay, so this is how we go ahead and we try to reach at the 3-vessel view. So this is the 3-vessel view. Okay, I hope you can see the 3-vessel view. Okay, so this is the 3-vessel trachea view. Now if we look at this 3-vessel view, this is 16-week fetus. You can see that this is the trachea, this is the V confluence, and if there is an aberrant right subclavian artery, we will be seeing that aberrant right subclavian artery coming from the tip of the V confluence. So we'll see the aberrant right subclavian artery coming from the tip of the confluence. Okay, first point. Second point is that aberrant right subclavian artery would come posterior to the trachea, and okay, so this is the second point. Third point is that it would take a straight course. So these are the 3 points, or rather 4 points, to be looked for ARSA. So the first point of the ARSA is that it would be coming at the tip of V confluence. Okay, second point, it would be posterior to trachea. Third point, it would take straight course towards right shoulder. And the fourth point is it would be seen at level of 3-vessel view. Okay, so these are the points that you have to remember. So this was a normal fetus, so no point of ARSA over here. This is just to demonstrate you. Okay, so now if you don't see anything abnormal at the 3-vessel view, then you just go cranially. Just go try and go cranially above the 3-vessel view into the superior mediastinum. Now this particular structure which is arising from the which is arising from the aortic arch, this thing. Can you see this S-shaped structure? Yeah, this in the structure in the blue, this is the normal right subclavian artery. So this normal right subclavian artery would take a S-shaped course. Okay, it would be above the level of 3 vessel view. Then it would be anterior to trachea, not posterior like an ARSA. Okay, and then what else? Yeah, so these are the things which you have to remember regarding an RSA, that is normal right subclavian artery. Okay, and yeah, so this is the way how we trace a normal right subclavian artery. Another tip which I would like to give you is that how to look at a normal right subclavian artery in real time. I mean to say, in your day-to-day practice. See how I do it is, I just ascertain the situs of the fetus once. If it is situs solitus, I just look at the apex of the heart. Say, look, where is the apex of the heart? You can see the apex of the heart. So this is the apex of the heart. Okay, so that means this is the left side of the fetus and this is the right side of the fetus. So this apex determines the laterality, that is the left side of the fetus. So I know that this is the left side of the fetus, so I have to look for an aberrant vessel which is going towards this shoulder. Okay, this shoulder. So always look at the apex of the heart and then try to find an aberrant vessels which is running away from the apex of the heart, and that is towards the right shoulder. So in this way you would be able to easily look at the right subclavian artery. Okay, so I know that this is the apex of the heart, so I have to look at the area which is away from the apex of the heart, that is towards the right side of the heart. Right, any vessel, any aberrant subclavian artery which is coming from the right side and moving towards the right side. Okay, so this is how I do it, and now I can see, I know that this blue S-shaped vessel which is coming and moving towards the right side is nothing but the normal right subclavian artery. And once I see the normal right subclavian artery, I'm pretty sure that there is no aberrant right subclavian artery. So this is how we do it. Okay, now similarly I'll show you in a 20 weeks fetus. So this is a 20-week fetus. Okay, similarly you can see the PRF is 75 right now. Can you see the PRF? Yeah, so this is the PRF which we use for a normal cardiac preset, but then I am decreasing it now. I'm decreasing it now. I decrease it to 25 centimeter per second. Can you see? Yeah, so this is the PRF which I use for looking at the pulmonary veins. Now once I look at the pulmonary veins, I see that there are two pulmonary veins draining into the left atrium. Then I try to reach the V confluence, that is the 3 vessel view. Now here is the 3 vessel view. So this is the 3 vessel view. You can see the different color in different arches over here, but that is because of the Doppler artifact, because the fetal heart is at 3 o'clock or 9 o'clock position. It's at 3 o'clock position. Yeah, so that's why we are getting different colors in different arches, that is red and blue. So this is just nothing but an artifact. Okay, now we can see that there is no vessel coming from the V confluence, tip of the V confluence. So we move up, we move up, that is cranially towards, and now we can see a vessel. Can you see this vessel? Yeah, this blue vessel. Okay, I'll mark again. Now this blue vessel. Yeah, so this blue vessel which is coming and going towards the right side, this is the right This is the left of the fetus. We saw that the apex of the fetus was towards the left. Okay, so this was the apex of the heart. So this is the left of the fetus, and this vessel is S-shaped vessel, is nothing but the normal right subclavian artery, and this is the trachea over here. Okay, can you see the trachea? Yeah, look, this is the trachea over here. So this is how we trace a normal right subclavian artery. Can you see the trachea? Yeah. So now I'll show you in a 28 weeks fetus. Yeah, so this is the we can see the apex of the heart, and the apex of the heart is towards left side. We can see the confluence, we can see the pulmonary veins. The PRF has been decreased to 18-20 centimeter per second. Okay, we can see the pulmonary veins draining into the left atrium. We can see the apex of the heart, so that is the left side of the heart. Now we have to look at a vessel. Okay, so this is the apex of the heart. I hope you can see. This is the apex of the heart. These are the pulmonary veins. Okay, this is the apex. So this is the left, and now we have to look for a vessel which will come out of the aortic arch and move towards the right shoulder. Okay, because this is right side. So this is how we do it in day-to-day practice. Okay, so this makes things very easy. Okay, now as we are moving up, we can see a vessel. We have not reached the actual V. Okay, and this particular thing, if you see over here, okay, this particular thing is not the aberrant right subclavian artery. This is in fact the azygous arch. So this is the azygous vein which is draining into the SVC. This is the SVC. This is the aortic arch, and this is the ascending aorta. Okay, and this is the pulmonary arch. So this is ductal arch, but we cannot see the aortic arch because it is a bit cranially. We are a bit inferior to the arch view. Okay, so don't get confused. My point is that don't get confused seeing an azygous arch. This is quite often seen. Okay, and this is quite often confused with an ARSA. So this is a differential of the ARSA. So I'll show you. Okay, this is the azygous arch draining into this SVC. And one thing, how you can differentiate in azygous arches, you will see in azygous arch always a bit caudal, that is bit inferior to the V confluence, that is an arch view. So whereas the ARSA is seen coming, ARSA is seen at the arch view, where we can see the V confluence. It comes from the tip of the V confluence, whereas the azygous arch is seen a bit inferior to the arch view, and normal right subclavian artery is seen just superior to the arch view. So this is how we differentiate between a azygous arch, an ARSA, and an NRSA, that is normal right subclavian artery. Okay, so this is the azygous. This was the azygous arch. Now we are moving cranially, and this is the V confluence. Can you see the V confluence? Yeah. And what is this structure? Okay, what is this structure? This structure is the brachiocephalic vein, which is coming from the left side of the fetus, and it drains into the superior vena cava. Okay, so this is the brachiocephalic vein, and this is the trachea, and this is the V confluence. Okay, and now we move even cranially. Now as you move even cranially, then we can see then this structure. This structure over here is nothing but a right subclavian artery. Can you see the right subclavian artery? Okay, this is the right subclavian artery. This is the right subclavian artery. Okay, this is the normal right subclavian artery. taking a shaped curve towards the, and this is the trachea over here. So this is anterior to the trachea, taking a S-shaped curve towards the right shoulder. Okay, here was the apex, so this was the left side, this is the right side, and this is how we differentiate it. So easy. Okay, and this structure, can you anybody localize this structure? This thing over here, yeah, this is the internal thoracic artery. Okay, this is the internal thoracic artery, which is a branch of right subclavian artery, and it forms the lateral border of the thigh box. Okay, thigh box. So this is the thymus over here. This entire thing is the thymus. This is the internal thoracic artery. This thing is the internal thoracic artery. This is a branch of right subclavian artery. So this is how we trace the right subclavian artery. Okay, friends. So this is a demonstration how to look for a normal right subclavian artery. And here I want to clarify one thing. It is very easy to locate a normal right subclavian artery. It hardly takes me 5 seconds or maybe 5 to 10 seconds to locate a normal right subclavian artery in any fetus. Ideally is to look in the apical or the lateral fourth chamber view, but with experience you can even locate a normal right subclavian artery in a basal fourth chamber view or a lateral fourth chamber view, or you can locate it very easily. And normal right subclavian artery, once you see a normal right subclavian artery, it automatically rules out aberrant right subclavian artery. If you use this simple technique, okay, of seeing the apex of the heart and then looking at the opposite shoulder, which is diagonally opposite to the apex of the heart, and then trying to look for a vessel, look for an artery coming just superior to the 3 vessel view, okay, and taking a S-shaped curve anterior to the trachea, going into the right shoulder and right arm, then that is a normal right subclavian artery. Don't get confused, mistaken it for a azygous arch. Okay, and also don't get confused between a brachiocephalic vein. Okay, though these two things are the fallacies. You can see, you can gain, I meant to say, you can mistake these two structures, that is brachiocephalic vein and azygous arch, sometimes with a normal right subclavian artery or a aberrant right subclavian artery. Okay, so you have to be a bit cautious. With experience, you'll gain more confidence and you'll be able to differentiate these structures. So this is a simple trick. Okay, see you soon.